Peter Neville.
Lovely to meet you.
Steve Riley.
Hello, lovely to meet you.
Do take a seat.
Thank you.
Panel interviews are an important part of the assessment process. Here they last around 10 minutes, and each of the assessors probes the candidates on different areas of their professional practice. Expect to be asked about your commitment and suitability for the specialty you're applying for. You'll need to explain why you think you have potential to succeed in the training programme and how you see your future in the specialty. They want to see what makes you stand out from other applicants.
Why medicine?
I think for me the reason I want to apply to medicine is that with all the jobs I've been doing thus far, from A&E to oncology to ITU, the bit that I've most enjoyed is the medicine, and specifically the acute medicine. So I've enjoyed looking after, for example, the ACCS, the acute coronary syndromes, diabetic ketoacidosis. It wasn't always the case. I wasn't always thinking of medicine. I thought my path would be very different, so it was a bit of a surprise, but that's what I've enjoyed doing. That's my motivation.
Okay, so what do you see yourself being or doing in 5 years' time?
I'd like to be doing something to do with acute medicine, whether that's as an acute medic trainee or an associated specialty. I'm considering at the moment, for example, sports and exercise medicine. Okay. I'd also like, as part of that, to be doing quite a bit of role in teaching and education. That's one of my interests. And hopefully in generally enjoying medicine and having the passion I still have at the moment for it.
Which she interviewed very positively. It was interesting to hear about her interest in medical education. It was interesting to hear about her desire to follow sports exercise medicine. I'm not sure I entirely understood the relationship between sports medicine and acute disease management, to be honest. I can see that might be desirable, but it's difficult to see how you could actually apply that in a acute medical context.
How have your rotations and attachments so far sort of shaped your career? You sort of implied that you've had a change of mind.
The attachment I've done, as I mentioned, I've done accident emergency. I've been fortunate to do cardiology, intensive care and trauma and orthopaedics. I was initially thinking that I'd perhaps be emergency medicine ITU direction. And whilst I enjoy those, I found that actually what I really enjoy is also having that personal patient contact and following the patient through their journey. So I think that hence for me why medicine at the moment is the better choice.
Okay, lovely. And what makes you stand out? Why should we appoint you?
That's a tricky situation. I think that for me, I'll learn on my feet very well. I like to think I can adapt easily to a situation. I think if I don't have the skill at the moment, I will move heaven and earth to acquire that. I also like to think that I'm quite supportive of my junior trainees. I've done quite a lot of teaching and education work already. So I'd like to think that you could have your trust in me to be a team leader and to support my trainees and to be somebody you can trust.
Thank you. I'm going to pass you over to Dr. Riley now.
Okay, we're going to explore another area of the interview now, and I'd like you to tell us about a situation where you've recognised there's been a conflict between the preferences a patient has got for treatment and the best evidence or the best practice that the doctor wants to deliver.
You're likely to be asked about your understanding of good medical practice, often through the use of a scenario.
You might have done it differently had you had the chance again.
Okay. So just to clarify, the doctor wished to give the treatment, but it wasn't.
The patient, there was a mismatch.
It's quite okay to pause to gather your thoughts and clarify what you've been asked.
I've had it quite a lot actually in my current job of oncology, especially where it's an area where there's a lot of evolving treatments, lots of issues surrounding funding. And I recall there was a particular patient who had very much hoped that he'd be considered for the final line drug of treatment, especially because he was quite young, his early 40s, had a family. But myself and the team could see that actually this treatment in particular would, if anything, shorten his life.
Candidates need to be ready to have these scenarios. The sort of things that we like to ask are usually scenarios that involve perhaps conflict or disagreement or reflection, the sort of cases that should provoke reflective practice and learning as a result of this. So where did this go wrong? What would you do next time if you were confronted with this? How did you learn from that?
He was then able to actually go home with his family and enjoy hopefully the time he had left. So one of the things I could have done, I think, to prepare was actually to go back through my portfolio and reread some of the reflective practice I had done so that it was fresh in my mind and I could directly relate to a situation and recall it accurately. So I think preparation has to be multifaceted. I think next time I will go back and more detail look at the reflective side of things from my portfolio as well.
Dr. Young.
Yeah.
And Dr. Neville.
I'm Steve Riley.
Why have you applied to this specialty?
Well, it's a specialty that I've had quite a lot of experience with throughout sort of med school, and then I've done a job as an F2 in anaesthetics and ITU. So I know that I really like the specialty, and I think it's something that I really like the lifestyle. I really like the people. When I've gone there, I've really liked the environment of the theatres, and I like the process that everything in anaesthetic goes through. The very sort of structured nature of sort of the ABC process.
Take the opportunity to demonstrate your knowledge and understanding of the specialty.
Are there any aspects of anaesthetics which appeal particularly to you? I mean, it's quite a wide specialty.
Yeah, I mean, I'm interested in the pre-hospital care part of it, and the sort of mixture between sort of A&E and anaesthetics is quite interesting. I just felt that I didn't have much preparation for the questions. Again, I just answered them as they came along, and I felt that I should have really focused on how I could have got more out of each question.
He was well dressed, he was well presented, he entered the room confidently and looked the interviewers in the eye, which is always a good start. I think when he started to answer the questions, I suppose what both myself and Steve felt was that he could have been a little more specific in his answers. He was quite generic and gave the sort of answers that one would perhaps expect from a young junior doctor who's perhaps just qualified.
100% prepare and actually write down what your qualities are and how they fit to the job. So actually have a list that you can bring to mind when needed.
Hi, nice to meet you. I'm Steve Riley.
Hello, Peter Neville. Do take a seat. So where do you see yourself in 5 years' time?
I think 5 years' time, I'd like to see myself with an ST post in intensive care. I've got particular interest in medical education as well, and I've undertaken programmes with medical students, teaching them fluoroscopies and ward-based teaching. So I'd like to perhaps be doing an MSc in medical education with the view to having that as a particular interest as a higher trainee or consultant.
So have you had any thoughts about which specialty you'd choose if you were pursuing that sort of...
I think when choosing a specialty, it's always very important to look at what the consultants are doing. I think what you might enjoy as a trainee often becomes very different as a consultant. So I think that is something to bear in mind.
How have your rotations and attachments that you've done so far since qualifying helped to shape your thinking about this specialty?
I set out with the aim of providing myself with a broad base of postgraduate experience during my foundation years. So my first year involved cardiology and respiratory medicine, with obviously a lot of physiology involved in that, and acute and chronic disease management, things that are particularly pertinent to intensive care. For my second year, I've also done accident and emergency medicine and anaesthetics in intensive care. And I think with those jobs in mind, I've developed a broad skill set, including sort of managing multiple pathologies at once, critical thinking, and obviously the practical skills that are particularly important in acutely unwell patients.
Hopefully I presented myself quite well. I think it's quite an alien experience actually as medics, because you have an interview at 17, 18 to get into medical school, and actually it's the first interview since. So it's a sort of a gap of 8 to 9 years before you get interviewed again.
What other skill sets are you looking for, do you think?
I think to be calm under pressure, a good team organiser, a manager, and someone who can sometimes step back and look at the broader picture in terms of where you're going with a patient.
Okay. I'm going to pass over to Steve now. Thank you.
Okay, we're going to move on now, and we're going to talk a little bit about good medical practice. I'm going to give you a chance to talk about a situation that you might have been in where you've recognised a conflict between the interest of patient preferences in terms of their treatment and the best clinical practice that a doctor wants to provide.
One that comes to mind is during a cardiology rotation, a patient came in with AF with bradycardia who needed a pacemaker.
When you're answering any question about things that you've done, it can help to think of the acronym STAR. So you talk about the situation, the task, the action, and the result. You'll impress the panel if you're able to explain what you've learnt from the experience and what you might do differently next time.
I think beforehand, you've got a fairly good idea that you can have some sort of professionalism question or a clinical scenario. I think the best thing to do is just prepare an example of good practice, example of bad practice and where you've made a mistake perhaps, or a difficult patient. And I think what they're looking for is not so much of the clinical medical side, but actually how you reflected on it, what you learnt from it and what you did about it. I think that's particularly important in medicine these days, is reflective practice and constantly self-appraising and improving ourselves as clinicians. So I think you need to give a structured answer, give the situation, what happened, what you did, and ultimately what you learnt from that. I think perhaps what you learnt and how you improved afterwards is the most important part of any sort of clinical or professional question.
Expect some probing questions about the scenario you choose and what you learnt from it.
And what have you learnt from that situation then?
I think what I've learned is, first I went back and had a look at a policy and best guidance, best practice. And I think if we are communicating decisions to patients, we need to understand ourselves why this is best practice for them.
Do you think doctor always knows best?
I think it depends what you define as best. I think there's medically best, and there's best based on sort of clinical evidence, and I think actually then there's what's best for a patient, and sometimes the two things aren't the same.
Instead of trying to devise a rote answer, which obviously you've got scope for mistake, I just put down what my reasons were, or the core things I wanted to put across in a question. And then with those in mind, got someone to ask with them, just to practice making sure I got across about 3 key points per question. So it's enough that they can remember them, and you've also then got enough time to go into depth for each of your key points.
This is a man who has thought his career path through and has already got a degree of mapping ahead of him. So this is a man who's already, you don't need to tell him where he's going to go. He's already got an idea in his mind, and that's a really positive thing to come out in interview. And he was very keen to get that out, and he was making a conscious effort to communicate that. And I thought that we both thought that was excellent, actually. The question that we want to know is, what is it that's brought you to this interview as opposed to a surgery interview or a general practice interview? And why is it you've chosen this particular specialty? And you need to be able to communicate that to us in a personal way that's relevant to you.
I think as doctors we're quite guilty of assuming that actually, yes, we can do this and it'll be fine, it'll be a breeze, and it's weakness to admit actually you're nervous or you may need a little bit of help and advice. So I think if people are preparing, don't be afraid to ask people to run through some mock scenarios with you, or to think about the questions that come up, to review your portfolio, and to be prepared to hear constructive criticism.
It's about just actually getting your own abilities out in that time.
I think you've got to keep everything in perspective, and I think if you are unsuccessful, you've got to see it as a positive experience that's going to help you grow and improve yourself as a candidate for the next time round.
Going into an interview is obviously a very tense and frightening situation for junior doctors. Some cope with it better than others, that's human beings. For an interviewer, it's also quite challenging in a different way. We're very eager to be fair. We're very eager to ensure that we offer a fair and balanced approach to assessment of candidates. I think candidates should try not to be frightened of us. Because we are there trying to bring out the best in the candidate and trying to encourage the candidate to do their best.
Be yourself. Don't lie or make things up. If you make a mistake, try not to focus on it, keep going. And above all, remember that they ultimately would like to employ you if you do a good job. So try and keep the pressure off and enjoy it.
To summarise, be ready to explain in a concise and effective way that you understand the specialty and why you're motivated to follow it. Show that you know your strengths and recognise and are improving your weaknesses. Be ready to talk about how you see your career developing and how you match the criteria in the person specification. Show that you've thought about the experiences you've had and have learnt from them. You can structure your answers using a technique like STAR. Describe the situation, the task, the action you took, and the result. It's okay to pause to gather your thoughts and clarify what you've been asked. Build a rapport with the interviewers through what you say and how you say it. Try to be yourself. Approach the interview with confidence. You've already done well to get this far, so make sure you do yourself justice. Make use of any careers support that's available to help you prepare.